a research and environment meeting, and
okay. Well, I'm not sure where Professor Terry went, but I'm going to say thank you, Professor Terry, for that introduction. And I'd also like to say thank you to the organizers for inviting me to participate in this IPE Day. So, good morning. If I were in person with you, I would expect you to say good morning, and I feel the energy and see the smiling faces. And so I am looking forward to chatting with you briefly this morning. So I'm going to share my screen. And so for my talk this morning, I've named it Shifting the Tide on Health Inequities and Social Injustices. I'm a quotes person, and so I found this quote and I thought it was appropriate for the time. And it states, "The world suffers a lot, not because of the violence of bad people, but because of the silence of good people." So this morning, I'm going to show you an optical illusion and ask you to tell me what you see. We're going to utilize the chat option so that you can tell me what you notice at first glance. I think that it's going to be important. You know, I know that we hear the terms health inequities and social injustices all the time, but I'm going to give some definitions so we can level set. And I think at the end of the day, what my overarching message is to say human rights. If we're all going to have human rights, we all need to know that health equity and social justice is for all of us. And then I'd like to invite you, if you aren't already, to consider being a diversity, equity, and inclusion and belonging. And I'll explain the belonging piece as an ally, an advocate, or an activist. And hopefully, Professor Terry will be back with us by the end of my talk so that you can put your questions in the chat and I will be happy to answer them. So this is a image picture that I had came across called Spirit of the Woods by Sandro Del Prete. And I'm just going to ask you to look at this picture and tell me what you see. There is a lot going on in it. I'm not going to take too long, but if you can just take about, 30 seconds and type in the chat what you see. So many of you are talking about the tree, the landscape. Okay. A man's face, a woman sitting backwards, a man and a woman, houses in the distance, a chopped tree. Yes, so many things indeed. Houses that are eyes, okay. The landscape outlining a man's face, a woman sitting. Yeah. So the reason why I bring this picture is to just highlight that oftentimes we can look at a picture and so many of us will see different things initially. As the longer you look at it, you may start to see other things. But initially, our eyes always gravitates to one thing or two things, and we then have thoughts, we then have perspectives. And so for those of you that actually, saw the person sitting, with the hat on and, said it was a woman that was facing the man. We see the man's face, but actually, in addition to that, there's a tree trunk in there. In addition, the houses that are in the back, which are the eyelids. And so, and there's a large tree that's, creating, the man's face as well. And so again, this is just to highlight that in life, we always need to make sure that we look deeper, we look further, and not necessarily just take things on the surface. So one of the things that I would also like to acknowledge, I think that it's important, we have one world, but we have so many different experiences. And so Jane Elliott says, we live in different realities, but when you deny what this person is going through, you are denying their reality. We are as different as we are on the inside as on the outside. And we have the right to be so. And people, don't deny differences. Accept them, recognize them, and cherish them. And so all of this that I'm sharing with you this morning is really about perspective and how we're looking at life, how we're engaging in life, and more importantly, how we're viewing each other and engaging with each other. So in order to level set, as I mentioned earlier, I am going to give you a definition of health inequities. Health inequities are systematic differences in the health status of different population groups. These inequities have significant social and economic costs, both to individuals and societies. Health inequities are differences in the health status or in the distribution of health resources between different population groups, arising from the social conditions in which people are born, grow, live, work, and age. Health inequities are unfair and could be reduced by the right mix of government policies. And I'm sure in the various studies that you've had, you've heard of social determinants of health. And we know that not everyone has access to healthcare, much less quality healthcare. We understand what neighborhoods and communities and environments create, and what not having parks, not having safety, not having transportation, whether or not you have a job, whether or not you've been incarcerated, what level of education you have or access to it, and the quality of it. And so social determinants of health, help to create the inequities that we constantly see and we know exist, that has been highlighted, especially in the last few years as well. And a lot of times people go back and forth between equality, equity. And so this image that the Robert Wood Johnson Foundation put together is to just highlight, yes, you can give everyone the same bicycle, but everyone doesn't have the same situation in terms of their same need. And so really, if we're really going to be thoughtful and we're going to really focus on everyone as an individual and their need, then we need to think about equity and make sure the child has a bike that's appropriate. The tall individual has what is appropriate for him, as well as those with disabilities. And so again, sometimes we don't really look and think about it in this totality, but it's important to make sure that everyone has what they need to live their best life, to have good health, etc. So we often hear about DEI, diversity, equity, inclusion, but I've actually started to think more about belonging. And I like to give the example that individuals can be invited to a party. However, if everyone at the party is engaging and this one individual is standing to the side, no one is asking them to dance, they may be there and you say you've welcomed them, but do they feel that they belong? And so I think that it's so important for us to also think about belonging when we think about diversity, equity, and inclusion. And this is just a diagram to say that diversity, we know that's multiple identities being represented. Equity is when it's fair and equitable treatment, access, and opportunity. Inclusion, thoughts and ideas of all individuals matter. But belonging is the feeling of connectedness. And it's so important to make sure that everyone feels as if they can participate and they're seen and they're heard as well. So I think that key steps to achieve health equity, it's important for us to identify the important health disparities and acknowledge that they do exist and what they are. And in your roles, when you graduate, some of you may be working in these fields now, some of you will be looking to work in these fields. It's important to acknowledge that we need to change and implement some new policies. We need to address the laws, we need to address the systems, the environments, and the practices that currently exist, have existed for quite some time, if we are going to really reduce the inequities in the opportunities and the resources that are needed so that we can have health for all. And unfortunately, this is not a quick fix because this is something that has gone on for quite some time. So it's going to take work. It's going to take some effort. But I think that it's also important when you're part of the system and you have an opportunity where you need to say, okay, we have a plan, but you need to reassess that plan. You need to make sure that that plan is still current for present day and whether or not this process needs to be tweaked in order for you to then continue to move forward and take the necessary steps to move towards health equity. And I always think that it's important when you have plans, when you have benchmarks, that you evaluate and you monitor what's being done to make sure that your efforts can be measured so that you can then have data to say, these are the steps that have been taken, these are the outcomes, we're going in the right direction, or maybe not. What do we need to do? And so I think that health equity is achievable, but again, we must have a plan. And if the plan that we have isn't foolproof, it isn't working, we need to be able to say, you know what, some additional changes need to occur. Now, social injustices, the last 2.25 years have definitely highlighted. Many of you may have participated in marches and have gotten involved. But for, again, level setting, social injustice is when actions are taken that infringe upon a group's rights, marginalize their opportunities, and treat them unfairly. And just 3 common ones, homophobia, ageism, and discrimination are examples of social injustice. I think we've all seen these words, we've heard these words: prejudice, racism, intolerance, discrimination. We know about religion, aggression, segregation, and the list goes on. But I just, shared this word cloud just to say these are things that are real to many. And it's definitely evident in this society. And we just cannot ignore, and we should not ignore what is present day. So I remember as a kid, we always used to say, hey, I dare you. So I'm going to dare each and every one of you to become a change agent. Because I know, and I'll just say, I probably should say, maybe I believe, but I'm confident you're here because you really want to get an education to be able to make a difference. And it's not just to make a difference in your field, whichever that is you choose, but it's also to make sure that while you're making that difference, you're also focused on the society and the impact that you can have in a positive way. So I dare you to be the change agent and utilize your ability to be responsible as a community member, to collaborate and to facilitate with others, to bring the passion and the enthusiasm that you have present day as it relates to your education, your work, your career, and try to be inspiring. I encourage you to be committed to lifelong learning. I know many of you will say you can't wait to be able to graduate, but at the end of the day, each and every one of us has an opportunity to make sure that we're always learning. And not only learning in terms of educating in knowledge, but we also learning about ourselves. We're growing, we're developing, and we're also learning about others. It's so important on life's journey to be capable of reflecting on yourself and assessing yourself. Many people will say, I'm a work in progress, but that's a good thing. It's important to know that communication is key, and we need to be able to engage in conversation, be dynamic, and be clear. We tend to be a reactionary society, but I encourage you to be proactive, be creative, and importantly as well, is that there are systems, of course, but you want to be a thinker, a critical thinker, and use that ability to solve problems and to make a difference. I think we used to say, I dare you more than once, so I don't know if this is double dare or not, but I encourage you to amplify the message, to break down the barriers, and to secure support for all of us. So if you've never dipped your foot into the ally, the advocate, or the activist role before, and you're saying, these last few years made me think about, what is life and how can my life be more meaningful? But you didn't really know where to start. I'm going to share 4 tips with you. I encourage you to educate yourself as much as you focus now on school and being the best student you can be and get the best grades. Educate yourself on diversity, equity, inclusion, and belonging. And be prepared that change is not going to be quick because this system, this structure did not happen overnight. So pace yourself. But I also want to say it's important for you to understand and leverage your privilege. A lot of times we don't really want to acknowledge that we are privileged, but we are. The mere fact that you are where you are right now, you are privileged. And you have a responsibility with that privilege to make sure that you are also benefiting diverse groups. Don't be a follower, lead by example. Always have an open mind and stand up for change. We all have voices, and it's not just to sing. So I encourage you to use your platforms. Many of you are on social media, and use those opportunities to educate and again, support diverse groups. It is so important on life's journey to make sure that you build partnerships, you collaborate. I like to say many hands make light work. So I encourage you to think about becoming an ally or an advocate or an activist, but don't sit on the sidelines. Don't watch. Be a part of it. Be a part of the change. So I just want to say, remember, in order to shift the tide of health inequities and social injustices, we all will need to take part in it because we all have a role. We do. And for the sake of humanity, do not sit on the sidelines and watch, but stand up and be a part of the changes the world so desperately needs to experience. And remember to say, count me in, and not just say it, but mean it. I'd like to say that for me on my life's journey, one thing that I've learned, and Maya Angelou sums it up in her quote, I've learned that people will forget what you say. People will forget what you did, but people will never forget how you made them feel. So I would like to say thank you. Thank you for the opportunity to chat this morning. I hope you have lots of questions that you are putting in the Q&A. But I think that it's important, and I'll just share a little bit about my journey for a moment, to say that at one point I was a student trying to figure out, first doing well in school and what type of career I wanted to have and what type of job, what company or what institution I would be at. And I did all of that. But as Professor Terry mentioned earlier, one day I heard the words, "You have breast cancer." And at 38, that was jolting. That's not what I expected. And my world was forever changed. It was changed because I then had to start experiencing things, i.e. health challenge, but also it helped me to see as I was moving through the healthcare system, the inequities that were existing. And although I was an individual who was happy to write a check and donate, I realized it was now time for me to take a different position and to actually get out there and make a difference. And so I've had the opportunity over the last 2 decades to be able to do outreach specifically in my community, helping to educate on cancers, in specific breast, ovarian, and uterine, and other topics. But I've also realized that research is important, and I've gotten the opportunities to participate with many study teams to recognize, again, the inequities that exist, the injustices that exist. But I always say that although trials are important and research is important, we also need to have policy. So I've gotten involved in legislative advocacy with a few patient advocate organizations. I share all of this to say that sometimes in life you have one trajectory or you believe you're on one road, but life changes and things change for you. And I have to say that you can be the top of your class, but if you're not taking the time to make a difference in someone else's life or being the rainbow in someone else's life, you have to say, have I really done enough? So I am going to stop sharing my screen and I am open to questions.
Wonderful. Thank you so much, Desiree, for those amazing comments and for all that you do. I apologize about losing Wi-Fi earlier. There are a number of wonderful questions that have come in, so I'll just read those out to you. First, how would you approach using social media to educate?
Well, I will be honest to say that I am not consistent in the social media world. But when I was, I think that, it's important, one, to always make sure that you have the facts. And what you're sharing is actually factual and not opinion, or if it is opinion, you just need to state that. And so I just encourage each and every one of you, whether it's, Facebook, whether it's Twitter, whether it's TikTok, for those that are really creative, I think, or even Instagram. These are opportunities for you to put together sound bites, put it in short stories, putting in information to make sure that people are understanding what is going on, whether it's in their neighborhood, whether it's in the region, whether it's, in the country. And so I think that, it's safe to say that we have more access now to information than we did 30, 40, 50 years ago. So let's utilize the mediums and the platforms that we have.
Wonderful. Can you describe a little bit more about the health inequities that you've witnessed, particularly as it pertains to women of color and breast cancer?
So the reality is, when I was diagnosed as a young woman, it was a bit startling for the standpoint that in the media, the PSAs that were out there then used to say that the incidence of breast cancer was high in the Caucasian community. It was low for women of African heritage, although the mortality was high. And I think that, unfortunately, that gave people a false sense of this has nothing to do with me. But the reality is, as time passed, it became evident that the incidence of breast cancer in the brown and Black community, it was high. The mortality remained high. And the truth of the matter is that, young adults diagnosed with breast cancer are usually of African heritage. So it was important, for me to be a face to the disease, to go out into the community, to talk about what breast cancer is, to help educate, and also to say, I was diagnosed as a young woman. We need to know our bodies. We need to listen to our bodies. We need to advocate, because many young women have gone to the doctor over the years, saying they felt something and had been dismissed for a variety of reasons, because they thought they were too young. But the reality is, age is not saving you from hearing the words, you have breast cancer. And the reality is, unfortunately, we don't have the screening tool other than the mammography, which is not really ideal for young women. So it makes it a little bit more challenging. But I think that it's so important for us to realize that we have to utilize, what screenings are available, but most importantly, we need to know our bodies. We need to make sure that we're doing the breast self-exam so that you know what your breasts look and feel like, so that you can potentially be able to detect the difference and then be able to go to the doctor and say, something's not right, I need to get further evaluation. I think that we need to also, make sure that we get the access to the care that we need and not let fear stop us from moving forward, because fear is real. I'm not going to say that it isn't, but I think it's important for us to understand that with the science that we have, we understand more about diseases, breast cancer and specifically, that I'm talking about. And so we need to be able to take advantage of the knowledge that we have today in order to make sure that we have a quality of life after the words, you had cancer.
Thank you so much. I know, Desiree, you've worked within so many different healthcare systems, and this question is about how you would address calling out inequities within the healthcare educational system when there could be fear of disregard or retaliation.
Well, that's the thing I think about being an advocate or an activist. You can't let that be a concern to you. As I said, many people will sit in silence and not say anything. But if you have an opportunity, you see something, they used to say for New York City MTA, if you see something, you should say something. And I think that it's important, to understand, yes, the lay of the land, but I think that it's also important, again, to have a strategy and a plan. There has to be someone else in the organization. If you're not one of the senior people that is senior, that you have a relationship with, that potentially also can see what's going on. You may be closer to the ground. I like to say boots on the ground as opposed to being in the ivory tower in terms of leadership. But whatever role you have, if you see something, you should be able to take the time to speak up, because not speaking up, not only does that not help you, but think about the person that's experiencing whatever the issue is. You're leaving them out there and they've already feel isolated. They already feel degraded. So I just think that it's important that, we not sit in silence. We take the necessary steps. We find like-minded people and we start to try to make the change that we want to see.
Absolutely. Very powerful words. Someone did also write in thanking you for your powerful words. Can you tell us more about your experience they wanted to know about with legislation? I know you have been very active in training people for Hill Days and days in Albany. Can you say a little bit more about that kind of training? How can you get involved in that? For the people.
So, I think usually an individual that gets involved in legislative advocacy is based on experience, whether it's personal or that, of a friend or loved one. But I think that it's so important to understand that you don't get a lot of time, whether it's with your particular lawmaker or one of the members of his or her staff. So you have to come prepared. You have to understand, what it is you're really going to address, if it's a specific bill, all the ins and outs of that. But if it's not, and you just really want to start to build a relationship, have a story, have a pitch. Elevator pitch is what I like to call it, so that when you go in, you're able to capture their attention about something that is important to you as an individual, as their constituent, or something that is important to the community that they're supposed to serve. And so I think that it's important, one, to identify who the person is on staff that is focused on whatever it is you're going to talk about, to be able to build a relationship with them, because all lawmakers have gatekeepers, and you just need to find out who that is and build a relationship, because that is the person that's always going to then open the door to get you in, as opposed to you having to wait unnecessarily a long period of time just because they don't know who you are and they're busy. Because especially in these times, there's so many different things that are being focused on at the end of the day. And so I think that, one of the things, whether, whatever state you live in, but we're here for New York, to say, to find out who is your lawmaker, whether it be in Albany or whether it be in DC, and make time to either call or make a visit, make an appointment, make a visit, and make sure that whatever you're talking about, you have evidence to back it up, you have the data, because you need to be able to substantiate that whatever it is you are asking them to focus on, to sign on as a bill, or to even propose as a bill, you need to be able to explain why that is so important at the end of the day.
Fantastic. Do you have time for a few more? There's a lot
Sure.
of in the chat, so hopefully you'll stay on and see all of the thanks.
Yes.
This question here is about, thank you again for your wonderful talk. My mother's a breast cancer survivor of 12 years, and this hit home for me. As a Black woman in health advocacy, what would you say is the best way to advocate initially for people of color, especially regarding health literacy?
Well, thank you for sharing. I do facilitate support groups for women of African heritage. And so I have women that are part of my group, i.e. newbies, as well as some that are 30 years out. So if your mother would like to be a part of a support group, at the end, perhaps you can get in touch with the organizers so that you can reach out and be happy to support her where she is on the journey. But one of the things that I think that is important, we need to, and I appreciate you raising it, health literacy is important. And we don't really acknowledge that we have not done a good job to help to educate people on what the different diseases are. And we often find ourselves getting a diagnosis, and that's when now we're trying to learn. And I say that that experience is like trying to drink out of a fire hose. It's not ideal. And so I really think that it's important, you know, for the institutions, for the government agencies, et cetera, to make sure that the PSAs and the different campaigns that exist, you know, are able to really help to clarify, to explain in plain language what these particular diseases are, what the symptoms are, what you should be doing. If you get a diagnosis, what are the options that are available in terms of resources? And I just think that we need to do a better job to help people to understand what is possible. Maybe you will never get cancer diagnosis. Maybe you will not have certain health challenges, i.e. hypertension, diabetes, or cholesterol. But the likelihood, as you age, the body changes and something will become a health challenge for you at some point. We need to make sure that the information is out there and it's clear and people can understand what they need to be thinking about, what behaviors they need to be modifying, what risks they have no control over, so that we can actually be making better choices about our behavior, our lifestyle, our diet, at the end of the day, because I think we need more education to understand what we're dealing with so that we can plan and prepare differently than we have.
Thank you so much for that. And you've given so much wonderful advice already through your formal presentation. The next two comments I'm going to group together because it does speak to kind of your personal journey and advice you would give to all of the students and providers on the line. Thank you again for sharing your personal journey because it's so powerful what you've been through and what you're doing to combat health inequities. So the first question is about if you could list some of the healthcare inequities that you faced personally, and what would you tell providers to combat this within our own practice? And the second, which is related, is when you were moving through the healthcare system, what were some of the mannerisms or ways in which doctors behaved or spoke to you about your cancer that kind of indicated these underlying inequities? If you could speak to those questions, that would be great.
So I'll share a little bit of my journey, and I think it will speak to some of the questions that were posed. Before I was at the point and where I am now, where I consider myself to be an activist as well as an advocate in many instances. I had the good fortune of working on Wall Street for a premier investment house. And so the reality was that when I was diagnosed, I had access. I had quality health insurance. I had connections, and I had a great experience. However, my second diagnosis was 8 years following my first one. And that's when so much became more visible because we had experienced an economic downturn, and I was laid off. And I knew, having had cancer once, that I was going to be at high risk. Didn't want to have cancer again, but I knew I was high risk. And it was important for me to hold on to health insurance. Some of you may know about this, others may not. But when you leave private insurance, you have an opportunity to, if you're not going into another setting where private insurance is available, you have an opportunity to get something called COBRA, where you actually pay into the insurance at a higher rate, but it's still under the group that you were originally under. And I felt like, although it was expensive, it was something that was important to do. But I did not realize that COBRA ran out in a year. And I found myself, with a second diagnosis in active treatment. And I got this letter saying your COBRA is about to expire. And I was not near the end of my treatment, nor did I have a job prospect because of the challenges I had with my second bout. And I then had to go into the system. And I remember trying to even figure out how to go about, how to navigate, because the healthcare system is a maze in itself. And it doesn't matter how much higher learning you have, you realize things are challenging. Nothing is clear cut. And so there I was trying to figure out, how do I get social services? I had never went into a social service setting before. And I remember, figuring out where to go. I went there, and then it was like, well, where have you been? You're not even in the system. And I said, well, I've worked all my life, but here I find myself, I need insurance. I need emergency insurance so that I can potentially continue my treatment. And that's when I realized, what it's like to be the least of these, and how people start to deal with you and treat you as a result of the fact that, quote unquote, you don't look like you have great circumstances. And that's one of the things that further propelled me to do the work that I'm doing now, to really go out and to talk about the marginalized, to be a voice for the voiceless, et cetera, because I experienced firsthand the struggle of being able to navigate the social service system, to be able to get insurance so that I could potentially continue with my treatment. And one of the things that I would say is that although I've gone to the best cancer centers, I clearly can say, as I look back on experiences, that I wasn't always given the right to ask questions. And I wasn't always encouraged to share in the decision-making as well. And so I would just say, I don't know, and it would be great if we were in person. I could definitely know the different areas that you're looking to embark on with your education, your careers, et cetera. But I just want to say that it is so important, and that the optical illusion that I had given, it was important for me to share that with you, is because I want you to know that if you have patients, if you have clients, et cetera, see them, get to know them. Get to know who they are, and make sure that whatever it is you're offering in terms of treatment is going to allow them the opportunity to still live the life they used to have and have those connections, so that at the end of the day, life is still important, it's still meaningful. Because oftentimes, when you get disease, you're given a treatment that can potentially not only change your life forever, but not allow you to have any semblance of what you used to. And although we don't talk about it enough in this country, mental health is real. And if you don't feel good about yourself, if you are overwhelmed by disease, it's clear that depression is going to surface. And although this therapy, yes, but at the end of the day, it's still an experience that did not have to be, just because you didn't ask the right questions as a provider. The individual sitting across did not know what they should be asking in terms of pointed questions. Communication is not often as clear, and it's often not acknowledged that individuals who now hear news that is disappointing, where fear sets in, that they may not always hear everything that you're saying to them in order to be able to process. And so it takes time in order for you to be able to check in. What did you hear? Have them repeat it back. explain things more than once. And so I would just say that, for me, I've been at the top and had, great experience, but I've been in the middle and I've also been at the bottom. And this is what fuels me each and every day to say that, what, we all should count, we all matter, and we all have a right to be able to live life as fully as possible. And so whatever opportunity you have on life's journey to make that difference in someone's life, you should do so.
Thank you so much. There's a couple of questions in the chat about the evolution of your work. I know you've been a dedicated health warrior for decades now, and specifically they wanted to know kind of how this changed over the pandemic, and if you can speak to specific policies and your work with that.
So I think a lot, I initially was doing a great deal of outreach, but my outreach has always been in the African-American community. I've also spent a lot of time working with the seniors at senior centers, as well as with NYCHA housing. And the reality is there's a lot of great organizations out there trying to offer services. But with the pandemic, many people do not have internet access. And what I like to say, the digital divide is real. And so unfortunately, many of the organizations that I was working with had to shut down. And they were trying to figure out how they were going to connect with their client base, and that became a challenge. And so although, I often say that, as simple as it may seem, I acknowledge that I am privileged that I have access to Zoom or WebEx, and I'm able to connect with people around the world through these platforms. But I do have to acknowledge that this is not the way that many people communicate or have access. One, perhaps it could be not having the tools, but also sometimes people are not comfortable with all of the technology that is available. And so in the work that we do, when we design things, we often tend to think about apps and all that that can offer, which is great. But again, not everyone has that. So we still need to think about those who do not have all the bells and whistles that I would like to say that the 21st century has provided, so that we don't forget that they have needs too, and we want to be able to reach them where they are as well. And so for me, I then, for those that could, utilize Zoom or WebEx in order for me to do educational talks. I've utilized that platform, but I've also done a lot more old-fashioned stuff. Just trying to talk to the groups, through audio conference, to be able to share information with them as well. And I think that, what I have started to do a little bit more of is really, working with study teams, with research, to really try and look at, what's being done in those spaces to make sure that those individuals who traditionally have been underrepresented in research, that they're not forgotten, and that, there are actually recruitment plans. There's a thought behind how to enroll everyone to make sure that, the science that's being done, the research that's being done, it's for all of us, and that we are truly advancing by the work that we're doing. In addition to that, I've gotten involved with a few government agencies as well to say, as funders as well, you have an obligation to make sure that people are getting what they need, and that you're not just focusing on one particular group. And although a lot of this work, as I said, in terms of trying to get to health equity and social justice, it's a lift. It is. It's change. It's a big change. It makes some people very uncomfortable. But at the end of the day, when you're trying to do good work, you find that you will be fueled, and your passion will not disappear, and your fire, the flame, the light, it will still stay ignited so that you have an opportunity to keeping on, and know at the end of the day, when you rest, when you lay down to sleep, you can definitely say, the day was hard, but I know I moved that needle a little bit further.
Wonderful. If it's okay with you, two last questions. One came in just recently, which if you are a provider, a person of color who's a provider and is exhausted and wants to be in the space where we are treating patients of color, but also exhausted by the inequities that exist within the medical system for themselves to operate in, what kind of advice would you give them?
Yeah, being exhausted is real. At the end of the day, one of the things that I tell myself, and I definitely share with others, I realize that there's only 24 hours in the day, and the demands are often many, especially in times like this where we have so many stressors that are outside of our control, as well as the demands have shifted, especially if we've had to support other family members, etc. But it's important, when you're doing this type of work, trying to make a difference, it's hard work, it's tiring, burnout is real, but we all should have self-care practices. I can't emphasize enough that it's important for you to have practices that you do on a daily basis. And there are times where you may need to do a little bit more. And so what I try to do is, in the midst of the madness, in the midst of the clock ticking and the hours growing shorter and shorter on a given day, I make sure that I step away. I carve out time for me, because many of you, I'm sure, have had the opportunity to travel on airplanes. And one of the things that we hear before the plane takes off, if the oxygen mask should drop, put it on yourself before helping your neighbors. And I think that oftentimes we forget, while we're trying to do good, that it's important that we take care of ourselves as well, because otherwise you can't be your best self, and you can't really share, volunteer, care, pour out from an empty cup. And so you have to pour into yourself so that you're able to give to others, and to be able to support others and encourage others. And sometimes, you know what? Life gets hectic. It does. But when you feel like you need to step away, hopefully you're in a circle that is supportive, and the individuals can see that you just need to take a moment and disconnect. And they can allow you to disconnect because you know that somebody else is there at the helm, continuing to steer the ship, and things are still going to be happening without your presence for a moment. But always be kind to yourself, be good to yourself, because you can't really do this work if you're not healthy, both physically and emotionally.
Well, on that note, thank you so much, Desiree, for all that you do and all that you are. And I can't imagine a better person to kick off this IPE Day. And thank you all for joining. And I hope you find the rest of the day as inspiring as today, and live by the words of Desiree, and we'll all be okay.
Thank you so much. Thank you so much for the opportunity. Have a great day, and all the best in your success in your studies as well as your career.